Professor Adu, can you unmute yourself?
Hi, and welcome to this seminar, which is entitled Impact of COVID-19 Nationally and the Way Forward, organized by TIIKM Group and in relation to the ICOPH 2020 webinar. My name is Dr. Professor Himatram Yadav. I am the moderator for this group, and we have 5 excellent speakers this evening. For some of you this morning, and we would like to welcome the panel speakers as well also the participants from all over the world. I understand there are more than 300 participants taking part in this webinar. I will be introducing the speakers and the panelists later on, but for now I will just introduce the subject by taking a few slides, which Kirti, can you put forward my slides? My slides, please. Next. Now, just as a background, in December 2019, the COVID-19 outbreak occurred in China, and this pandemic has spread to about 150 countries worldwide. And the cause of pandemic is a new coronavirus, as we all know, and coronavirus is a family of viruses which cause mild to moderate upper respiratory tract infections. And previously, as you know, there have been coronavirus outbreaks in the world. I think 2003, there was the SARS outbreak, and then later on the MERV outbreak. Coronavirus, apparently a group of viruses which cause mild to moderate upper respiratory tract infections, and they are likely to have been originated in a wet market in Wuhan. That's one of the theories, and of course there are many other theories as to where it has been, originated. It has probably been found mutated from a coronavirus from animals, because especially the bat and the pangolin, which is supposedly another animal. And the pandemic has caused severe and health economic problems worldwide, and many countries in the world now are actually affected by this pandemic. Next slide, please. A brief on the epidemiology of this disease. The signs and symptoms, as we all know already, that fever and dry cough, which are the main signs and symptoms. And you get tiredness, pains, aches, and headache and conjunctivitis. And the transmission previously was, we were not sure, but now it has been confirmed that person-to-person spread and airborne and droplet, although it has been known that it originally moved from animal to the humans. The average number of secondary infections in this is about 3.28 to about 2.79 per case, which means for every case that is identified in the world, probably there are 2 or 3 cases out there which may not be diagnosed or which not be confirmed. Incubation period for this disease is about 5 to 6 days, and it ranges from 1 to 14 days. So it will take as long as 14 days before the disease occurs in the individual patient. The disease is occurring in high proportion among the elderly, and apparently the children is much less comparatively to the adults. And the adults who are actually getting affected mostly are those with the comorbidity like hypertension, diabetes, and immunocompromised diseases. So it is quite a problem for having elderly people being affected. Currently, there's no treatment and immunization available for this disease. And treatment, some countries are using antimalarials, hydroxychloroquine, which actually is not confirmed, but then they are using this treatment, and immunization is still yet to be prepared, and many countries are moving towards finalizing this treatment and vaccines to be related. Next slide, Kirti. The Very briefly, our panelists will be discussing a lot of this in detail, but I don't intend to discuss in this detail, just a general introduction. Coronavirus can survive 4 hours on copper, mind you, and if you're taking any vessels which contain copper, 4 hours, 24 hours on cardboard aerosols, cardboard 24 hours, and then aerosols about 3 hours, and 3 days on plastics and stainless steel containers. So you can imagine when if you are affected or if you get involved in any of this thing, the virus can last quite long at this point. Now, one of the main hygiene is currently the main thinking about how to control washing hands regularly. And then the second thing is social distancing, 1 meter distance from the next person. I think this worldwide, this has become a big issue. Social distancing is actually helping apparently to reduce the number of cases because the infection is spread is lower. Avoid going to crowded places, staying at home, follow good respiratory hygiene, and fever, cough, breathing difficulties, get the test done, and wear a mask if in high-risk area. This is some of the prevention. Our panelists will discuss some of this in much more details and what you call in detail to relevant to the situation. Next slide, Kirti. Next slide, please. Globally, currently, there are about 5 million cases already. This slide was as of 21st, which is yesterday. And right now, there were 5.5 million cases. Americas has about 2 million, of which the United States has about alone 1.5 million cases. Europe, 1.9 million cases. Most countries which are affected, as you know, Spain, Italy, Germany, United Kingdom are the major ones in Europe. Eastern Mediterranean. Western Pacific, China is included in Western Pacific. China currently has about 82,000 cases. And then you have got South Korea, which handled the epidemic quite well. Japan and then Taiwan, the Philippines. Malaysia is in the Western Pacific. We have about 7,000 cases in Malaysia. And then you have other countries as well. The next comes the Southeast Asian region. Not yet, please. The Southeast Asian region, 148,000 cases, of which India has got already about 112,000 out of this 148,000 cases. And then the last is the African region, which is the lowest in the region. Notice that the death rate is ranges from 6.68 globally, which means every 6.68%, which is quite high at the moment. And Americas has got about 6%. Europe has got over 8.79%. So this is a global situation currently, but it's still spreading. Apparently, China, although was able to control the epidemic quite well in the first round, apparently in the last few days, there are already other 2 cities which have shown the increase in the number of cases of this COVID. Next slide. Now, the panelist speakers for this presentation, we have Dr. Chandana Gajanayake, who is the Deputy Director of National Hospitals in Sri Lanka. He will talk about some of the issues related to this COVID-19. And then we have Dr. Vineet Alex Daniel, Professor, Department of Oral and Maxillofacial Radiology in Annor Dental Hospital in Kerala. Then we have Dr. Surangi Jayakody, Department of Community Medicine, University of Jayewardenepura in Sri Lanka. And then Professor Nurpudji Astuti, President of Clinical Nutrition, Physician Association of Indonesia, and she's currently working in University of Hasanuddin in Makassar, Indonesia. And Dr. Farzan Rahman, Assistant Director, Research, Bangladesh Nutrition Center. These are the 5 panelists. I will now not speak more than that because the panelists have a lot to say. So I'm going to introduce the first speaker, Dr. Chandana Gajanayake. As I mentioned earlier, Dr. Chandana Gajanayake is Deputy Director of National Hospital in Sri Lanka, Ministry of Health. And he has over 20 years of experience in public health sector. And he has worked in the field of hospital quality improvement, supply medicine for public health institutions, head of the patient care institutions and training institutions. And he has worked as a director of premier dental hospital in the country and dental officer in Sri Lanka Ministry of Health. He has published several papers, and he is also presented papers and in various international conferences. He will speak on the spread and prevention of COVID, economic aspects, and how the COVID and Sri Lanka helped to improve the situation. So without much ado, can I call upon Dr. Chandana Gajanayake to deliver his address or speech. Dr. Chandana.
Thank you, Professor Yadav, and thank you very much for that kind introduction. And I'll be talking about the Sri Lankan experience again with the impact of the COVID-19. As Professor has told you, the virus is a new virus. And what are the things that we know about this virus, right? It comes from the corona family, and most people do not get much symptoms. And I think Professor has told you how it transmitted. And then we'll see what our governments can do to improve the situation. So this is a responsibility of the government as well as the academics and the intellectuals who are advising the governments what to do. So the main thing that we have to understand, or the government has to understand, is that the people are suffering because of this illness, and people are suffering because of the measures that the government are taking to control the disease. Therefore, it is utmost important that government maintains the transport facilities for the essential services, because the hospital staff, the healthcare workers and other people has to come to work. So it is important that you maintain the transport facilities, and we have seen experience that in our hospital as well as in the other hospitals, that when the transport is affected, even the healthcare staff does not come for work. So the other thing is maintain of essential services. Now essential services has to be maintained, like food, and then the water, and then the other sanitation facilities, and maybe other facilities that depending on the age and the area. And the other thing is agriculture, because if we stop agriculture, then the next episode would be a starvation episode for the country. So it is very important that the government maintain the facilitate to agriculture. And then the financial bailout, because of this COVID epidemic and the actions taken by the government to stop the pandemic, all the economic activities of the country has stopped. So it is very important that the government come out with a bailout plan, financial bailout plan. For example, in Sri Lanka, they have given concessions for the credit card payments, concessions for the loan payments, and concessions or the postponement of payments of agricultural loans, and so on and so forth. There are different schemes for different areas. So it is very important that the government has to understand the people are suffering of this thing, and then keep the general public informed, because to control the epidemic, the governments are taking drastic measures, and people have to be informed correctly so that the people do not fade their trust in the government. So it is very important. Otherwise, the government will not be able to maintain the general rule of law within the country. And then they appreciate the good work of the other people. For in Sri Lanka, the healthcare staff, the police, the Triforces, everybody has got together in controlling this epidemic. So I think once in a way, the people, or maybe some highlighted people, or they have to be appreciated, so the morale of the other people also boosted. And the mode of spread and prevention. I think Professor Yadav has given a very good introduction or very good understanding about the mode of spread and the prevention, right? Because of this thing, this spread is going through the droplets. If we can prevent the touching of nose and the eyes and the face, and do not keep a distance of 1 meter, it will be very helpful. But on the other hand, now if you understand these things, these are very simple measures. The problem that we had to face was that we never anticipated a disease like this. Globally, we were getting ready for nuclear wars. We were getting ready for something terrible, or maybe a star or something coming into the earth. And we were never expected a simple respiratory disease will strike the world with such magnitude. So the exponential spread is the real problem, because this is not a very deadly disease. And if you can see, the death rate is usually about 5%. So the flattening of the curve, I am not going to elaborate on this, because other panelists will be elaborating on this. So this is a simple thing. The problem comes because of this exponential growth. The healthcare facilities will not be able to cope up with the numbers. That is the problem. So you have seen in some parts of the world, the grounds were turned into hospitals, and the storing facilities were turned into hospitals. So because the available healthcare facilities are not sufficient to cope up with the numbers of the patients. Now this is a 2-3 days old photograph of the Sri Lankan spread. Now the yellow areas are areas where we haven't had a patient for the last 14 days. Green areas are the areas where we had a patient for the last 14 days, but at the moment we don't have any. The red areas are the areas where we have a patient within the last 14 days, and we still have a patient in that areas, at least a single one. So it is very important to understand, with all these difficult measures, how people were able to survive. Right? Now in Sri Lanka, I'll be talking of the Sri Lankan experience mainly. Right? Now in Sri Lanka, the curve has never gone beyond the level of healthcare facilities availability. So people were able to get facilities or treatment from the healthcare facilities. And the healthcare workers were able to wear adequate PPE for the patient care. And people were able to admitted into hospitals. We haven't had a problem of constructing hospitals or converting stadiums to hospital or something like that. So it was a very fortunate situation that we were able to handle those things. Now, on the other hand, the economic problem has hit the Sri Lanka quite hardly. So, but we were transforming ourselves to working from home. So working from home, some people have understood there are some advantages of that as well. Like we will be able to work in a comfortable environment. So the traveling is less. So people are every day facing the problem of traveling. There's a lot of fuel, and the cost of traveling is very high, and it pollutes the environment as well. And because of working, we have to hire or rent a house in the city. So the house rent is not there anymore. So the congestion is less, the pollution is less. So those are some advantageous points that people have experienced with this working from home concept, right? So what did people do during the pandemic period, which was about 1 week ago, right? We are still not out of the pandemic threat, but we are still at the moment, we are trying to coming out from the threat. So there were a lot of actions were taken: lockdown, curfew, travel restrictions, social distancing, everything. Now in Sri Lanka was divided into 24 districts, and there was a time only the healthcare workers and the people who are transporting the food was able to cross from one district to another district. So the restrictions were such strict. And then we came up with the concept of work from home. Of course, some work cannot be done from home, and some work had to be adjusted a little bit so that it can be done from home. So it effects to the economy. So last year, we were forecasted to have about 4.5% GDP growth. But now it was estimated the GDP growth would be 2% or less than that. Because the main income avenues of Sri Lanka, like apparel, tourism, construction, consumer goods, all these things have been affected really badly because of this global pandemic. So now we can understand what is the way out for academics and students, right? So they will not be able to travel much. So therefore, we had to encourage desk research and literature review and reading, or maybe distance learning, right? Or rotation of appointments. Now, in our hospital, some registrars are deviating from their routine appointments and doing some other rotations. And use of modern technology, some things like that, like this, webinar, Skype, Zoom, MS Teams. Now the Postgraduate Institute of Medicine in Sri Lanka, they are having board meetings using MS Teams. We are having a discussion using Zoom. So these are the things that we can do. And this is something that has encouraged with this demand of epidemic. Some people came up with new ideas. Now this is a photograph of one young doctor who is working in a hospital, came up with a modified ventilator. So because if we use a ventilator with an ambu bag in a infected patient, the infected air comes out and all the people who are in that room will get infected. And if we use it to a ventilator, the ventilator will get contaminated and we will not be able to use the ventilator anymore. So this young doctor who is working in the anesthesia department came up with a good idea and a modification. I think he is going for his patent application these days. And you can see the Prime Minister of Sri Lanka is also appreciating his innovation. So this is just an example. Similar things have happened in a lot of countries, and similar things happen in Sri Lanka as well. So this is what Sri Lanka did, and we are still keep on doing. Right? Social distancing and hand hygiene. These are very basic things, but these are very effective. These are very effective. In our hospital, we have established over 25 public sinks to have hand wash with taps and soap, and other personal safety measures like PPE or the mask. This is our health minister wearing a mask. So, will the world will be the same? No. Right? I think we have experienced that the China had a problem, and now the America is also facing a problem. So there will be different economic giants may come up now, because the world has experienced the weaknesses of these countries. Some other countries will try to take advantage of those things, right? And 73rd World Health Assembly was a virtual summit. This is the first virtual summit in the history of WHO and United Nations. And will the Asia be the next knowledge hub of the world? People are thinking of it, and we are going towards that. I think that is the way out for the Asia. So this is a good opportunity. International Conference of Public Health will be held in Thailand in September.
Dr. Chandana, can you wind up, please?
And knowledge sharing and sharing our experience. So that is all. And thank you very much. Okay, sir.
Thank you, Dr. Chandana Gajanayake. Just for the information of the participants, we are taking questions. I have noted a few questions, but as we will answer the questions at the end of the seminar. And as far as the time is concerned, I hope we can try to maintain the time within 15 minutes. So the next speaker is Dr. Vineet Alex Daniel. Dr. Vineet Alex Daniel is actually a professor, Department of Oral and Maxillofacial Radiology in Annor Dental College and Hospital in Muvatapura in Kerala, India. And Dr. Vineet actually has graduated from Savita Dental College, Bachelor of Dental Surgery, 1996, and went on to do his postgraduate in the year 2005 and in Savita University, Chennai. He's a diplomat in laser science from the University of Genoa in Italy. Presently, he's a faculty of Annor Advanced Imaging Unit in Kerala, Annor Center. He will speak on how COVID-19 was controlled in Kerala. And as we all know, Kerala was one of the best controlled COVID-19 cases in India. Although India has about 112,000 cases, I think Kerala was able to control the epidemic quite well. With that, can I call upon Dr. Vineet to speak? Try to maintain time within 15 minutes. Dr. Vineet, please.
Yes,
Thank you.
Thank you so much, Dr. Yadav. Good evening to all the fellow panelists and all the participants who have gathered here for this webinar. It's been a pleasure. I think it's a novel idea for the organizers to come up with this webinar, because it is much needed at this time, because it creates an awareness among the medical fraternity as well as the community and the general public. So I'll just brief you about what COVID-19 is basically about. So COVID-19, as we all know, it's not new. It was in the year 2002-2003, we had the SARS-1, that is severe acute respiratory syndrome, which was affected almost some 7,000 to 8,000 patients. And that was in the year 2003. And the mortality rate in that time was around some 10% of it. And people mostly died due to kidney failure or renal failure. Then after almost a decade, almost 9 years after that, we had the MERS, that is the Middle East Respiratory Syndrome, which the fatality was a little bit high on the higher side, where you had around 35% of mortality rate, and around some only 800 people were infected. This is because it was so severe and it was able to be quarantined properly. And after almost another 8 to 9 years, then we have a third cycle, which has gone beyond proportions. That is your COVID-19 or SARS-CoV-2. So why it has gone unnoticed is initially it started as basically a symptomless, or symptoms would be more usually like a common cold or influenza type of a virus. Then it began spreading so fast, and it spread almost became a pandemic. Now it is spread almost to almost 120 plus countries in the world. So that is the reason why it has gone unnoticed, because people didn't know much about it, and there was usually a fear of the unknown, and all these contributed to the, they didn't know how to prevent it. There was no cure for it, there was no vaccination, so it just spread like a wildfire. So what had happened is it just spread almost all over the globe, and even eventually almost all countries of the world are affected right now. So what is this COVID-19? So it is basically an RNA virus. And what this does is the mode of transmission would be around by transmission by air and by droplet infections. That is air transmissions by air droplets. So when you sneeze or when you cough, what happens is these droplets from your respiratory system, it could be your upper respiratory system, that is from the back of your throat, your nose, or your lungs, could be expelled out in the form of droplets. So what this does is that it's got several sizes. It could be either covered in mucus, or it could be mucus free, or it depends upon the size of the droplets. You call it as air droplets if the size is more than 5 microns. If it is less than 5 microns, it is called as droplet nuclei. So if their size is bigger, it tends to travel a little less. It falls down immediately. So if you have fine droplets, it used to stay in the air for a longer period of time, and it travels a lot. So that is about the mode of transmission. Then you have the spread. The spread could be either from a direct spread or an indirect spread. The direct spread is when you come in direct contact with an individual who is affected by COVID-19. And then you have an indirect spread that the patient or the victim who is affected by COVID-19 has his hands on, or which is contaminated by him. And when you get in touch or when you get in contact with those things, you get a indirect spread of kind of COVID-19 infections. So how long does COVID-19 virus stay alive out of the body? That is a very debatable question, actually. Some say it could be hours, some say it could be days. But WHO has put it as straight as it should be around some 2 days to 5 days. So that is the time period that the virus is alive. It could be some few hours as well. It could be 3-4 hours as well. But there was a cruise ship called as the Diamond Princess. After the crew had completely embarked that ship, what they found was after 17 days of that, they found live virus still in it. That was after 17 days after they noticed that the crew of that ship had been infected with COVID-19. So basically, there is no such thing as how long the virus is surviving outside the human body, something like that. So as Professor Yadav put it correctly, that there are some areas where you can say that shiny metal surfaces like your door handles, door knobs, your stairwells, or your elevators, ATM machines, your computer keyboards, your mobiles, all these tend to keep the virus longer compared to your fabrics, your clothing. So what had happens is that is what the transmission mode or indirect spread would be from. Then I should say that there should be the incubation period of these viruses. WHO has put it, the incubation period is the period when you get infected by the virus and when your symptoms start to show. So that is the period between it. So you get infected, then your symptoms start to show. The time period between them is called as the incubation period. So what happens during these incubation period is the virus is more infective, or that it is more propensity to spread. So what it does is the incubation period, as WHO has put it, to be around 2 to 5 days as max. So regarding this, that would be the commonest, and the clinical features, as all we know, it would be majorly involving your respiratory system. That would be your lungs, your oropharynx, and through your contamination through your oral cavity and the saliva, everything. So all these contaminants that would lead from your bottom of your lungs to the tip of your tongue, that is from the till your lips, would be all completely filled with virus in a completely blown up COVID-19 patient. So there is something called as a curve. So when do we plot a curve? Kirti, I just want you to put a curve on that. Can you project that slide, please? Yeah, so this is basically a curve that can be used for any kind of disease. Okay, so you have on the x-axis, that is the time period of the time since the first case was being reported, and your y-axis shows the number of cases that has been reported. So the red curve basically shows that there is a constant spike when the virus is spreading at last, when there is no healthcare system in place. But when you take the precautions correctly and when there is a healthcare system to take care of it, it flattens remarkably. So see that it comes remarkably well. So that is called as the flattening of the curve. So without any healthcare system, or if the cases spike beyond your healthcare needs, that is when you get a more number of cases than your healthcare professionals can handle. And when the healthcare systems and precautions are taken, you get a flattened curve. Can you change it? Yeah. So I'll be talking about a role model that has happened in my state, that is Kerala. So what they had done is, actually they were prepared for that. They had combated in the past a serious virus called as the Nipah virus. So they were well informed about what is the serious nature of this virus or what it could turn out to be. So what had happened is the containment started even before the central government had given instructions. And as on March 10th, it was completely, March 10th was the day I think the WHO declared COVID-19 as a pandemic. So even before WHO has declared this as a pandemic, all those malls, all the public gatherings, everything, schools, everything were closed down, and it went to a complete lockdown. Actually, it was the first state in India to go under a complete lockdown. So we were pre-informed. So there was a preemption. That is, something was bad was going to be happening, and they came to know about it, that this would be the scenario. And with the previous experience, they combated it in more an effective way. So what they did was they just followed the WHO protocol, which was to identify, isolate, test, and to treat the patient. So when you have it, you identify victims or the individuals who are infected with COVID-19. Then you isolate them. That is, the other word would be a quarantine, where you quarantine them. If they show symptoms, they would be quarantined in a hospital facility. If they don't show any symptoms, or if they they have a history of any traveling from abroad, that is the Mediterranean countries like Italy, Spain, or somewhere, or from China, at least safe to say. And if they are not infected with COVID-19, they would put us in a home quarantine. So then they would be aggressively tested. That would be on the real-time PCR testing. And then they would be treated for that. The treatment as of now, it's nothing but just the general precautions. And so that is what Kerala has done it pretty much in a well-structured manner, because it was from the highest level of the health ministry to the tertiary specialty, that is your tertiary public health service center. So they worked in tandem, and there was something called as this contact tracing. So in a case which was reported here, that they traced around 300 individuals whom the COVID-19 infected person was in contact with. So they essentially quarantined all those 300 numbers, and they restricted the infection from spreading even further. So imagine a state with a population of 35 million, and only we have around some 650 infected COVID-19 cases. And the death rate is very, very minimal. Should I say it's around some 3 deaths. So that's it. So we are dealing with a population of 35 million, and you have a death rate of only 3 individuals. So that is a lot more to say. Our health minister actually had an interview in the BBC 2 days back. And so everything was clear cut. It was planned. It was organized. It was, no time was being wasted. And public were given, community kitchens were set up, and rations were given, and all things were taken care of in the most prompt way. And quarantine, I should say that they were into this specific thing. There is something called as a reverse quarantine. So what do you do in a reverse quarantine? You quarantine essentially the individuals who are not affected. So you quarantine individuals who have lesser immunity or immunocompromised individuals. So people with hypertension, diabetes, liver diseases. So you essentially quarantine them, and we don't let them outside so that they can infect it. That increases. So this virus has got a peculiarity in infecting individuals who have lesser immunity. Now there is something called as a reverse quarantine, which has been done. And children, why they don't get affected? They get affected, but it's very less, because it is the vaccination that plays a major part in it. Because they are vaccinated by, say almost from 1 year to 11 years or something. They are completely in a vaccination period. So that must be a reason, but we don't know. So as of we know right now is to completely, we stay safe, so that we keep our family safe, and in that we keep our community, or our society safe, a much safer way. So there is no passive immunity when we get infected with the COVID-19, similar to chickenpox or a scarlet fever. So once you get infected with COVID-19, there is always another chance that you might be getting infected again. Either you can show symptoms or you don't show symptoms. So that is the peculiarity of COVID-19. So I would like to stress on this fact, only this fact, that we precaution ourselves, we take precautions, necessary precautions, because Kerala is a state which has got a high literacy rate, around 94-95%, and the Human Development Index is also very high. So people had the common sense to stay away from the public, to stay away from social gatherings and all that. So they took the social distancing, they took the precautions of using sanitizers, they used the precautions of using mouth masks and everything. So that came into play, and we certainly did a splendid job in flattening the curve, almost to nils, should I say. So that is what I request all of you to stay safe. Thereby you're saving the community, you're saving your society. I thank the organizers and Professor Yadav for giving me this wonderful opportunity to talk a few words on COVID-19. Thank you. Thank you.
Thank you, Dr. Vineet, Alex, for the excellent presentation. Now I will move on to Dr. Surangi Jayakody. Dr. Surangi Jayakody is currently a lecturer in the Department of Community Medicine, Faculty of Medicine, University of Sri Jayewardenepura in Sri Lanka, and a specialist in public health. She graduated in 2007, obtained her Master's of Science and MD in Community Medicine, and postgraduate from the Institute of Medicine, University of Colombo. And she will speak on COVID-19, a strategy update, expenses on Sri Lanka. Can I call upon Dr. Surangi to say a few words? Now, just before Surangi begins, I'd like to address some of the questions being sent through the Q&A session. Some of you are putting the questions in the chat. I would suggest that we will discuss some of the questions at the end of the session to the various speakers concerned. Thank you. Can I call upon Surangi to continue the session?
Yeah, thank you, Professor Yadav, for the kind introduction. So I will, can you see the screen? You all can see the screen, no? Hello?
Yes, you can.
Yeah. Okay. I'll start on the strategy update of COVID-19. So I'll be talking about the COVID-19, the strategies of mainly the Sri Lanka. What are the strategies we have adopted for the COVID-19? So to begin with, I would like to add on something about this COVID-19. Now all the speakers have now been talking about the COVID-19 epidemic, and three defining characteristics of the epidemic is the speed and scale of the epidemic. Sorry. Speed and the scale of the epidemic. So the disease has spread quickly to all corners of the world, and it is overwhelmed even the most resilient health systems of the world. So up to now, it has been spread over more than 200 countries in the world, and it has overwhelmed even the most resilient health systems in the world. And its severity, overall 20% of cases are severe or critical according to the available data, and crude clinical case fatality was reported as 3%. And also it has a huge societal and economic disruption. So these are the three defining characteristics of this pandemic, which is why we are all concerning about. And it is also exacting a huge toll on individuals, families, and communities around the world, because our daily lives have been profoundly changed due to this COVID-19 epidemic. And also economies have fallen into recession due to this epidemic. So due to the strategies adopted for the control of the pandemic, so all over the world, daily lives have been profoundly changed. And the post-COVID situation will not be same as the previous. So the daily lives have been profoundly affected. So these are the global strategies to respond to COVID-19. These were the strategies given by the WHO, World Health Organization. These are the global strategies, and each country has different strategies, but mostly the country strategies are based on these WHO strategies. The overall goal of the WHO is of the COVID response is to control the pandemic by slowing down the transmission and reducing mortality associated with COVID-19. So this is the overall goal of WHO with regard to the COVID-19 control. And there are a few strategic objectives mentioned by WHO. It has one objective is to mobilize all sectors and communities in this prevention, in the pandemic preparedness and prevention, and also to control sporadic cases and clusters and prevent community transmission. So all the countries are asked to adopt measures to prevent community transmission. But those who have adapted these measures properly have controlled the epidemic in a well-controlled manner, but the others who had the community transmission have a huge toll on the community. And to maintain the measures to suppress community transmission, and also to reduce mortality by providing effective clinical care. And also the WHO is concerning and stressing about developing a safe and effective vaccines for the researchers all over the world to come out from this epidemic. There's no way out other than, so we have to live with this COVID virus. So to develop safe and effective vaccine is the one way out from this. So it is also a strategic objective of WHO at the moment. And with regard to this global strategy, and everyone has a crucial role to play in stopping COVID-19. Each and every individual has a crucial role to play in stopping COVID-19. The previous speakers also mentioned about these things. And individuals must protect themselves and others by adapting to the behaviors. So the hand washing practice and safe health behaviors, the individual has the responsibility to adapt to these safe behaviors. And also all the communities must be empowered all over the world. In each and every country, there should be measures to empower the communities with regard to the living with COVID is not as living previously. So we have to live with COVID, and we have to adapt behaviors to live with COVID. And for that, the communities must be empowered, and the governments must lead and coordinate the response. The government has to take the lead and coordinate the response. And also the private companies must ensure the continuity of essential services. So everyone has a crucial role to play in stopping COVID. This is we can't, everyone has a responsibility in this. And with regard to country response to COVID-19, so if we take the countries all over the world, so there are two basic country response. There are two basic responses which countries have adopted for control of COVID-19. The two responses, you call it, one is mitigation and other one is suppression. So there are different countries that have adopted different responses, and because this is a new pandemic, all are now, it is the different responses are being practiced, and now they are experiencing the effects of these responses. So the mitigation and suppression are the two main responses. Mitigation focuses on slowing the epidemic spread and reducing the peak healthcare demand while protecting those most at risk of severe disease from infection. In mitigation, they mainly focus on the epidemic spread. They don't go for the stringent measures. First, they protect those most at risk, and they targeting on reducing the peak healthcare demand. So this mitigation is adapted by most of the developed countries, but there are some consequences of mitigation as well, and some of the countries later on change their response because some have failed this mitigation response, so they have changed later on for the lockdown and the suppression. And the other response is suppression, which aims to reverse the epidemic growth by reducing case numbers to low levels and maintain the situation indefinitely. So where suppression is where the countries adapted the lockdown early in the epidemic, and they aim to reverse the epidemic growth and to reduce the case numbers to low levels. Not only those most are not, they are not only targeting the most at risk, they target the whole community approach. So the low levels, they maintain the low levels from the beginning. The suppression, the Sri Lanka is also targeting the response, country response of Sri Lanka is also the suppression approach is adopted, because from the beginning we have targeted on the reversing the epidemic growth. These are the strategies to respond to COVID-19 in Sri Lanka. From here onwards, I will be talking about the Sri Lankan response strategies to control the COVID-19. So we mainly focus on suppression of the curve. As I mentioned earlier, first local case was reported in 11th of March 2020 in Sri Lanka. The first local case, it was on 11th March. And from there onwards, government has implemented the whole of government, whole of society approach, and we have taken stringent measures to suppress the curve, and urgent and aggressive measures involving health and non-health authorities. We have involved health and non-health authorities and taken urgent and aggressive measures to control the epidemic. So this is how we have responded to COVID-19 at the beginning. And we have adopted several public health interventions to suppress this COVID-19 pandemic, and we activate and scale up emergency response mechanisms from the beginning. So we have activated and scale up emergency response mechanisms from the beginning, and I'll be talking in the next slides where we have adapted these measures. And we have from the beginning of the epidemic, before the first Sri Lankan case reported, we have started on risk communication and public engagement. So we educate the public regarding this epidemic, and risk communication was started way before the first local case was reported. And we have we find, isolate, and test and treat every contact. So we have taken stringent measures to find and isolate cases, and we have test and treat every contact. So that is one measure Sri Lanka has taken to contain the epidemic, and also ready hospitals to protect and train healthcare workers. We have several designated hospitals all over the Sri Lanka to treat this confirmed COVID-19 patients, and also there are designated hospitals for suspected COVID-19 patients. So we have ready hospitals to protect and train healthcare workers with regard to this pandemic, and we take stringent measures to protect the healthcare workers from this epidemic. Those the healthcare workers are the frontline workers to facing this epidemic. So we have taken measures, and also we encourage an all of society response and community spirit, as I mentioned before, and also implement all the non-health sector measures to contain this epidemic. This graph shows how the cases have reported in Sri Lanka and what are the measures we have taken. So there are the black color shows the health interventions, the yellow color the government strategies, and the green color shows the health and non-health collaborative strategies. So the first case was reported in, now I have mentioned that it was reported, the first case, this is the Chinese national that was reported somewhere in end of January, and the first local case in the 11th of March. So from the first foreign case, from the beginning of the first foreign case, we have before that also with the pandemic, we have prepared the national Corona Task Force was established, and that was the leading body which responsible for all the control activities and the quarantine activity in the country. And also likewise, so we have prepared national guidelines for Corona COVID-19 cases, and we introduced general hygienic measures for the public before the first case was reported, first local case is reported. And also we have established quarantine units in our country, and then directly returnees from the suspected countries, returnees from the abroad, we directly send them for the quarantine units and keep them there for 14 days. And also we have established designated hospitals for treating COVID-19 patients. Likewise, there are stringent measures have been taken, and also with the report of first local case, the country has taken, the government has taken stringent measures to reduce the spread, such as the social distancing measures, such as we have we did our closure of schools and universities. All the academic institutions and universities were closed from 13th March, and also then again we have island-wide curfew was imposed, and the working from home strategies were implemented. Likewise, we have taken stringent measures to implement the social distancing, and also the whole of country was locked down from the 19th March onwards. Likewise, there are measures to control the epidemic, the pandemic, and the cases were we have taken stringent measures to isolate the cases, and contact tracing was done. So likewise, this graph shows the measures we have taken at different stages of this pandemic, and how the cases reported.
Surangi, can you wind up, please?
Yeah. So to see whether we have done enough, so
we are running out of time.
Yeah, to control this is to control whether the Sri Lankan what the Sri Lanka has done in response to China. We have learned several things from China, and these are the things we have done with regard to China because of the I will run. Okay. Okay, because of the stringent measures, now Sri Lanka is still at stage 3 of the epidemic, because we are still have the clusters. We don't have the community transmission of COVID-19. So we are still at the stage 3 of the epidemic due to the stringent measures. Okay. So this is to show the social distancing. So because of we have social distancing, we have imposed curfew, so the 75% of social distancing was imposed. So that is how we control our case load, by the social distancing. This graph shows how the social distancing control the case load of COVID-19. This is the accumulated number of confirmed COVID-19 cases in selected Asian countries. So you can see the Sri Lanka in the lower lines. Because of these stringent measures, we have maintained, and we have lower our curve. We have flattened our curve, and the case load has been the days since the 100 plus cases identified. You can see that our line is going lower down with compared to other Asian countries. Okay. This is to just to tell about the economic impact of COVID-19 on Sri Lanka. So as Sri Lanka has the economy is largely based on micro, small and medium-sized enterprises, and also depend on export revenue and tourism. So our economy is affected by COVID-19. So we have to take stringent measures to take this up. So this is the economic impact of COVID-19. We have dropped in tourist arrivals because of the lockdown and disruption of the small and medium-sized enterprises, and also there are some economic implications, but we have to face this after this with this epidemic. So I will these are my references, And thank you for listening, and I will wind up with this.
Thank you. Thank you, Dr. Surangi. The next speaker is Professor Nurpudji Astuti Daud from Indonesia. She is currently the president of the Clinical Nutrition Physician Association of Indonesia. And she's also a lecturer in the Nutrition Department, School of Medicine, University Hasanuddin in Makassar, and a clinical nutrition physician specialist at Hasanuddin and Wahidin hospitals in Indonesia. She will speak on how academicians, students, and corporate people can utilize the time for the future career in this COVID outbreak. With that, Prof. Nurpudji, please.
Yes, okay. I'm trying.
Try to keep the time because there are a lot of questions. I think we will.
Did you see this one?
Yeah.
Hello, did you see this the slide? It's all. It is slide already. See?
No,
not yet.
Not yet. Oh my God.
Yeah, now.
Yes.
Okay.
Now we can see. Now we
You can see?
Yeah, try to
Yes,
keep
Professor.
the time if possible.
You can see?
Yes.
Okay.
Yes.
Okay. Good evening for all panelists and participants international webinar. I will focus on how academicians, students, and corporate people can utilize this time for their future career development. If we show this here, today, COVID-19 facing in the world education system. With COVID-19, schools are rapidly changing the basic way they do their work. There are fewer right now face-to-face conference and collaboration, but they have effectivities for both teacher and student in terms of transportation. The pandemic COVID itself, impact to education through carry out distance learning. In here also, they are getting a lot of financial pressure to the institution. Besides that, they also have influence working activity through speed up digital access in all industry, because consumer and businessmen are increasingly dependent on technology. Also, in here, for the employee, the greater pressure for the new skill. And then for entrepreneur, they have localization of entrepreneurial opportunity. That's all impact COVID-19 for education and working activity. If see in here, the pandemic COVID-19 also change some behave before pandemic. Teacher and student right now are shifting to the online lecture. Besides that, the institution, that school closer to provide facilities, and then preparing for new assessment system. That's a big money for that to prepare that one. But parents, they're close to their children because right now they stay at home and preparing for providing facilities for their children. To do this one, to facing this COVID-19, we have to change our mindset. What is that? What we have to change? The first thing, we have to adjust the new normal. Before pandemic, teacher and student just said, every day we have to be present physically. But right now, teacher only as facilitator for learning. And also student, they said they feel they have ability, or then they have also should be present physically. But right now they don't need to that one. The learning doesn't to be face-to-face, and they can take responsibility for their learning. To be or to go to the new normal, we have to do through adaptation. So we need transitional adaptation. The question is, what kind adaptation we have to do? The first is educational sector. Why this one? Because we are doing online education, we need adequate quality of service. We need electronic library. We need continuing professional development for teacher. And we need commitment for many sectors. And also for students, we have to prepare their facility. And then for ourselves, we have to change our lifestyle. We have to increase our personal hygiene through practice hand washing and frequent laundry. We have to using masks, and we have to increase health awareness and do physical distancing and more teleworking. But here our problem. Our problem is the computer. The computer access for home for teacher. There is no corporate laptop, and they have also VPN connection. And student, what the problem for this student? They have limited Wi-Fi. They have poor connection. Also, the technical problem with webcam and sound, the capacity limitation and software solution. So, how about the impact to the resident, the medical doctor who take the specialization? In here, we have to change. We have to change and re-evaluation again. We are doing the limiting number of residents who be working inside ward by adjusting the shifted schedule. Before we just put them every 6 hours. Right now, we decreased to 4 hours. And each resident must wear adequate personal protective equipment that is very expensive. And also, there's any kind right now, any kind activities that involve mass gathering, changes into online, including final examination, research proposal presentation, and thesis presentation. For residents who came from outside Makassar must be self-quarantined for 14 days. To prevent spread of COVID-19, residents should maintain personal hygiene and avoiding masks. Here, we do this one for our residents. How academicians, students, and corporate people can use for their future career development? Yes, they can it. Through what? Through e-learning. What else? They have to forcing everyone to the work educational system. And also they have to do physical barrier. That will, students, that here they will be furnished with the better knowledge literacy for society that will enhance the instant learning. Then also they can work from home. That somehow become possible in some sector. But the very important thing, that moving business to online, health screening, physical distancing, and personal hygiene would be daily activities, more frequencies than before. So many experts predict that this quarantine for COVID-19 will boost a competence-based learning. Students, which is unique one to another, can study at their own pace. Some experts are not agree to this because it depends on the system as well. So, my opinion, the world will change a lot. Now people can use to video conferencing. In education, present to a lecture should not be compulsory anymore. Student-centered learning will become real. Professor like you and me doesn't merely belong to your institution. You are belong to all of us. For example, I'm not only belong to my institution or my country. I'm now belong to people outside my country. I could give lecture online to everybody. Related to online business, that will go faster. People start to enjoy everything in front of their door. Delivery services will become the central of business process. Telecommunication will grow faster too, with the presence of super high-speed internet. Higher quality of video conferencing will be aimed to industry. Parents enjoy staying with their kids. They don't have to go out very much anymore. Many of this activity can be done from home. File can be stored in cloud. In conclusion, I will say COVID-19 accelerate information technology. In education system, it can increase computer literacy to everyone with internet access. It can minimize physical and geographical barrier between teacher and student across the world. Eventually, it will brought us to a global competition. Thank you for giving time for me. I'm giving back to Professor Hematra.
Thank you. Thank you, Prof. Nurpudji, for the presentation. I will now call upon, last but not the least speaker, Dr. Farzana Rahman from Bangladesh. Dr. Farzana Rahman is currently serves as the Assistant Director Research, Bangladesh National Nutrition Council, Dhaka, Bangladesh. She has 6 years experience as a government officer in Bangladesh, monitoring and evaluation of the national nutrition activities in Bangladesh as one of her key responsibilities. She's also the member of Sun Academia Research Network in Bangladesh and currently working for developing the nutrition research strategy in Bangladesh. She will speak on how people can contribute themselves to overcome the crisis situation in relation to Bangladesh in particular, but generally as well. Dr. Farzan, I hope you keep the time because we have got some questions as well. Thank you, Prof. Farzana.
Can you hear me?
Yeah.
Thank you. Thank you, Dr. Yadav sir. Assalamu alaikum. I am Dr. Farzana Rahman from Bangladesh. At first, I want to give thanks to the organizer for giving me the opportunity of being a part of this webinar on behalf of my country. Wishing you Holy Ramadan al-Mubarak and a very good evening. My talking point is how can people contribute themselves to overcome COVID-19 by maintaining social distance. Now, we are saying this social distance is physical distance. Now, the question is, what is physical or social distancing or how we can maintain it? Physical or social distance is avoiding close contact with others to prevent the spread of COVID-19. At least keep 6 feet distance from others. Staying home in case of illness, working from home, keeping kids away from group setting, avoiding visiting long-term care setting and non-essential trips. In our country, the first case was detected 8 March 2020, and due to lockdown, we are maintaining social distance from 26 March. However, new cases increases. Total cases of COVID-19 till today is 30,205. Dead are 432. In Bangladesh, preventing further spreading, we are trying to maintain social distance strictly. Due to technological advancement, people can connect from one place to another part of country by mobile computer within a second and can get and share the recent news quickly. Government are continuously increasing awareness among people through different multimedia. Please show the slide, please. I have something to show you about our country's present scenario. Please show the previous slide. The previous slide. Yeah, thank you. Here is a picture of different emojis which we can use simple social distancing tactics like repressing hugs and handshakes with alternatives. If we all do our best to stop the spread, we can flatten the curve. Here is the sign the first is wave, the hand on heart, or namaste, or the assalamu alaikum, or the eyebrows lifting, and see, look after yourself to look after us all. And this will flatten the curve. It's also very important to keep ourselves and our family healthy in this time of COVID-19 pandemic. Next slide, please. Hello, can you hear me? Hello, can you hear me? Yeah, thank you. Now the way forward for getting relief from this pandemic. On the screen, there is an image of a famous cartoon series in our country named Mina. The recent episode of this cartoon made about the COVID-19 crisis situation. How the children can infection from virus, social distancing, hand washing practices diseases, and these influence a lot to our community children, along with the elder, to raise the awareness situation board, and this continuing of this problem create a psychological effect. We can inspire them to read books online, for playing together with family, and tree plantation, watching TV and video games, etc. Next slide, please. The next slide, please. Oh, are you there? Yeah. Here is the picture. Here is a picture of our engineering university student who has made the hand sanitizer with their own cost, and how we can volunteer our youth time. Younger people can offer to pick up and deliver the shopping trees or other things, and raising fund through digital media. And they might need, who are in needy, self-isolation and quarantine, and their time and labor could be a big help in our country, such as like we have started a website named Crack Plateau for getting available transport for doctors in Bangladesh in this lockdown situation, like Bindananda Foundation, which is started by a group of friends, started this database ongoing support initiative for healthcare workers. And this foundation makes daily food doctors and other peoples who are in needy. You can see the pictures next. Next slide, please. You can see the pictures next of giving relief to needy people by this foundation. Next slide, please. Can you hear me? Next slide, please. Yeah. And next, please. Yeah. Next, please. Next slide, please. Next, please. This is all the 3 pigs are of giving relief to the needy people. Yes, fix this. We have to still empathy and concern to our health workers, because our health workers are current heroes of the world. They put their lives and safety on the deadline for all of us. Health professionals should be accorded full respect and utmost concern. We can contribute this to abide by protocols. We should never assert our social status and political positions, if only to beat around the bush. One way to cheer them on is by hanging a green ribbon on a door or gate, or by adding a green ribbon to our profile pic. Next slide, please. This is the picture of the doctors community who are treating the patients. Next slide, please. Next slide, please. Next. This is the disinfection tunnel and the social distancing picture. This is the picture of how people maintaining social distance in their daily work. The next one is the disinfectant tunnel and taking step for searching infected people. You can see among workers and others who have to go outside for their daily urgency. Next slide, please. This is a very, very positive attitude, positive picture of our police force in Bangladesh. We have to show positive attitude towards the police and army. You can see in the image that how Bangladesh police force inspiring and cheering the people by singing who are in lockdown at home. And in the next one, in Bangladeshi army patrolling and shaking people for being outside. The next slide, please. The Bangladeshi army are trying their best, and many of them sacrifice their lives. So we have to show utmost respect and love for them. Next slide. Next, please. Yes. This is a nutrition message which is made in Bangla for the common people of our country. This is the message and other precaution so that people cannot get infected by the virus, which is created during our National Nutrition Week from 23rd to 29 April 2020. And this was informed through the multimedia in the whole area of Bangladesh, both rural and urban community, for making awareness. Next slide, please. You can see this is the picture of hand washing. We have to take steps, stop hoarding alcohol and hand sanitizer if we want a better world. Have to learn to keep our community's need top of mind and share the simple things. We have to encourage people for washing hands frequently for 20 seconds, which is shown in next slide. It protects us and everyone around us. It only takes 20 seconds. I have something more to say, except this PPE. There is a good idea for a rent payment relief for self-isolated people. If a landlord have the extra income, he could consider, as some landlords reportedly have in our country, freezing rent payments and ensuring no evictions occur for any tenants struggling financially due to the pandemic, and check in on elderly neighbors, although necessary social isolation can be lonely. So we can text, phone call, or email, or if needed, in person by supplying them good book digitally, or if possible, hand to hand for time spending, and so that they don't lose their hope of life. We can send them funny memes, gifs. We have to make sure so that they feel less alone and have social support. Here you are watching a video of social distancing, how social distancing makes an impact on slowing the virus. Yes, dear audience and panels, thus we can prevent the spreading of COVID-19 infection from one to another by keeping people physically distanced. And social distancing doesn't mean we can't feel close to our loved ones. We have to be creative, have a video chat to get together and celebrate birthdays or other occasions using everyday tools like Skype, Hangouts, or Zoom, or synchronize watching our favorite TV show or movie together while chatting via text or video. And combat misinformation. Unfortunately, if not unexpected, misinformation on COVID-19 is floating around online. If anyone see it, please can report it to their platform, and we have to get information from trusted sources like the World Health Organization or doctors or reliable government sources. And it's said that prevention is better than cure. For preventing of this pandemic, social physical distance is one of the main way of forward. We should keep remember that awareness is the solution of this pandemic, not being panicked. So please be safe and stay at home. Thank you all for being with us. Wishing you a Eid Mubarak and good wishes for getting relief from this crisis earlier. Thank you again.
Thank you, Dr. Farzana, for the presentation. Now we have finished all the 5 panelists' what do you call speeches. What I intend to do is answer a few questions. I took the liberty to answer a few questions, but if anyone of you are not comfortable with that, we can again raise the issue. So I'm going to ask some of the questions are specific to some speakers. I'm going to just go some of the questions. The first question is, Dr. Surangi, addressed to you from Noor Asia. She wrote in the chat, she asked, can you please explain the appropriate clinical care in Sri Lanka to reduce the mortality? I don't know whether you will be able to answer the question on clinical care to reduce mortality. Surangi?
Yeah, the main thing is we have, as I mentioned in my presentation, we have designated hospitals for COVID cases from the beginning. And we have separate clinical staff, and we have developed guidelines for the COVID-19 patients. And and we have also all the public was being aware about the symptoms and signs. So we have early recognition, and early diagnosis is the key to success in our case, I think.
Yeah.
Hello?
Okay. Thank you. Hello. Yeah. Okay. Surangi, next question is actually addressed to, I think, to Chandana. I'm going to read the question. Did we not, for the last 10 years or so, anticipate a pandemic of this magnitude? And this is why all countries were getting prepared with pandemic preparedness plan, as well as carrying out simulation exercises with scenarios where surge capacity was tested and hospitals were overwhelmed. So the question is, did we not
Yes. Now,
Basically.
I
Can you
think some of the countries has done some simulation exercise and was ready, I suppose, maybe. But I am just thinking whether if we were ready, and this is the scenario, what would have happened if we were not ready? So I think though we were getting ready, but we were not getting ready for something like this. We were getting ready for something different. So that is why over 1 million people have been infected at the moment. And some of the countries are still struggling to overcome this problem. Now, I don't think that the resources and the training has played much of a role in facing this problem. Some of the countries who are struggling are the most resourceful countries in the world.
Thank you. I hope that answers the question. Next question is from Professor Shashi Bumuri. Post-COVID, will the food habits and living style, maybe I ask Professor Puji to answer this question. Post-COVID, will the food habits and the living style likely to change? What will be the impact on food security and safety, where people can't afford to buy good food due to poor economic worldwide? Maybe Prof. Puji.
Okay. Okay.
Prof. Puji?
Yes.
Will be
yes.
able to answer that?
Yeah.
I think Dr. Farzana can help if you want to.
Yes. Yeah. After pandemic, the people will change.
Please.
Yeah. All people will change the lifestyle. Yeah. They're already for 2 months, 3 months right now, stay at home and eat more food, fresh food, and cooking by themselves. And this one will continue because we don't know the COVID-19 will disappear for this year, maybe until the end of the years. We don't know, because until now they still have an increased number of people with the COVID. So we will change. We want or we don't want it, but we will change. That we call the normal, the new normal. We will change. Everything will change. But the problem is, people in the big city, in urban area, more have impact than people in rural area. Because we don't want to go outside without anything we want to buy, or we want to find out. We will stay at home. In Indonesia right now, there are increased number of COVID, especially in my hometown right now. There's the number 5 people with COVID-19. And I have a lot of medical doctor and resident who will suffer with COVID-19. That's my answer. Thank you.
Thank you. Dr. Farzana, want to add? Food?
Yeah, I am here.
Okay. Next question is, what type of diet do you suggest? Of course, after following all precautions, what sort of special may be needed in the long run once the lockdown is lifted?
The diet.
International travel starts, how often you need to change the mask in a day? So there are multiple questions in this. One is, what sort of diet you suggest? Maybe Farzana can do that. And then how long, what sort of special diet may be needed in the long run? And then if international, I'm confused, but anyway, so what sort of diet? And how often you need to change the mask in a day at workplace or travel? That one, anybody
Okay, I will give the
can answer.
answer of,
Yeah,
of mask.
Chandana?
Yeah, I will give the answer of both.
Yeah, give both, please.
Okay, thank you. The first answer is always we have encouraged our people for taking the food which is rich in vitamin C, A, E, K. We think we call that the antioxidant rich food which boost up our immunity, such as the green vegetables, green leafy vegetables, and the fruits, and loads of water, and for less carbohydrate, and a fixed amount of protein, and always maintain the lifestyle modification and a balanced diet always. And the balanced diet is included the fixed amount of carbohydrate, fixed amount of protein, fat, and vegetables, and fruits, and water. This is not only for this pandemic situation. This is for the all time we have to maintain, and so that we can get relief from being attacked from the chronic cases, which is non-communicable diseases like heart attack, or NCD, or hypertension, or diabetes mellitus, all kind of disease. To get relief from all kind of disease, we have to maintain strict diet. And the second question is the using of mask. If it is the N95 mask, then we have to use this once, and then we have to keep this N95 mask in open air for 5 days, and we can't wash it, because otherwise its activity will be destroyed. And if the other mask, like which is made of the cloths or the other elements, we can wash frequently, but we have to give it in sun bath for destroying the virus. I think I have completed my answer.
Yeah.
Maybe I have to add something for that one.
Yeah.
Actually, to improve the body immune, they need to eat more protein. That protein that come from fish, from meat, or from the nuts, or something like that. Yeah. And then also in this time, they have to take supplement, especially for the elderly people, and also for people with the comorbid with the disease like hypertension and diabetes. They should take a medicine, and they should consult to the doctor. They don't need to take or just eat what they think they can improve, but they have to consult the doctor. Just make a call. That's all.
Thank you. Can I address the next question to Vineet?
Yes.
Vineet, there's a question by Frida Abuea. She asks, social distancing. How can we assure proper social distance in all places? And what best recommendation you have for African countries?
I think the best known for social distancing would be, like, it's difficult to maintain in most of the places where people are trying to barge in or something like that. But now when the pandemic is getting serious, I think the WHO has implemented some rules on social distancing. So it would be a minimum of 1 meter to say around 2 meters. So the ideal would be around 1 meter for any shopping malls or something. It doesn't matter from which country you are. Social distancing is got this minimum basic. That is, you either maintain a distance of an arm's or more than an arm's length of around 1.83 meters to around some 2 meters. That would be the ideal recommendation of preventing a transmission from any airborne infections or viruses. So that would be my answer.
Okay, the next question is from Marianne, and she asked, maybe any one of you can answer this. What are your practices in the preparation of schooling after this quarantine? What preparations for schooling? How do we handle schooling? Can we allow all the students to go? Because this relates to social distancing as well, and then probably hygiene, because schools is going to be the biggest problem when we go back. So anybody want to answer this?
maybe the first thing, maybe we have to make sure the pandemic is over, because in France they are open for 1 week for children, and then they're closed after 1 week because 70% shouldn't get infected.
So what do you suggest? So where the schooling? What do you
My
suggest for schooling?
suggestion, yeah, we have to do first personal hygiene, yang the first thing, and then the second one is physical distance. That's that's very important one. I think.
But even if you, even if you do physical distancing, now you have a problem, because if you have a class of 30 people, and let's say you do physical distancing, the class will become 15. So how do you handle the next 15?
We are still doing online.
Schools?
Yeah, I would like to put a solution.
They're sitting.
Professor,
Yeah.
Okay,
Rosanna.
Dr. Vineet. No, Dr. Vineet.
Yeah, so
Vineet,
I think these are school-going students, or say, as you told Professor, so 30 students or something. I would recommend to take it batch-wise, so divide it into 15 and 15. So the timings can be changed from, say, in the morning 8:30 to 12:30, and the next batch will be around from 12:30 to evening 3:30 or 4 o'clock. So in that wise, you can split a classroom or something, so that eventually your social distancing is maintained, as well as there is less contamination.
Okay. I won't dwell on that too long, because it will take a lot of time for the teachers anyway to repeat and teach twice. But never mind. I'll go to the next question. It's from Dr. Aisha from Pakistan. She's a long question, but she asked basically the impact of COVID-19 on mental health of the people. Because being physically affected by this disease is no doubt a big challenge. So for how long lasting effects of such non-treatable widespread pandemic? Basically, the issue is on mental health of the COVID-19 cases as well as the public. How do you handle because it has created a panic worldwide. So now we have this mental stress and things like that. So how do we handle this anxiety, stress in the future? Anybody want to answer that? Mental stress due to COVID-19.
Yeah, I have included my slide.
Surangi? Okay, Farzana.
Yeah. That's from getting relief from this mental stress.
Yeah.
We have to take care of people according to their age, such as child, adolescent, and the elder people, by according to their mind refreshment, and always take care of them, and give them enough time, with call them or text them or give them video or good books, so that they don't lose hope and don't get psychologically stressed. I have included in my slide, in my presentation.
Yeah,
Maybe
okay.
if she hasn't.
Right, thank you. Maybe I'll go to the next one. Next question is from Gayatri from Tamil Nadu. Do we really can get over it? Can we get over it, or we have to learn to live with this infection just like common cold or any other respiratory diseases? Question is, do we live with this disease forever, or just like accepting it as a common cold in the future? Or we just still keep ourselves in a panic situation? Anybody want to answer that?
Yeah, I think we have to live with COVID-19 unless we have find a vaccine for this. So we have to live with it, and we have to practice this social distancing measures, and as well as the personal protective measures. And I have mentioned this in my presentation as well. The post-COVID is the same as the previous. So we have to practice this hygienic hand hygiene and other hygienic practices. And also, if we have a vaccine, we can overcome this. I think we have to live with this.
Yeah, so you think vaccine will be a solution, but I also think the other one is probably because China is working very hard and many other countries as well. some form of antibiotic as well. So vaccine and antibiotic are two things moving very fast, and they expect by end of this year or early next year, they probably have a vaccine which may be able to relieve some amount of mental stress among the people on this, because currently there is a total stress. So hopefully the vaccine and next question is on deaths evacuation from China, Italy is still under control. No. Would we change more online teaching, clinical cases, bedside clinics? Prof. Astuti, this is a question to you from Kevin Fernandez.
Yes.
Would we change more to the online teaching, clinical case and bedside clinics? How do we address that?
Okay.
Online teaching, yeah.
For
You
students
have
who
bedside teaching as well.
okay.
So how do we address that?
Yeah, we are using video call. So the student, the residents for clinical teaching,
Using?
For clinical teaching, the student we are using video call. So there we saw the patient, and then after that we make assessment, and then we discuss. So we change everything because we don't need to stay a long time beside the patient. We just need 1 hour and should go, because there is a lot of things in there they can spread out for our students.
Yeah, but if you do that method, would it affect quality because you're not seeing the patients, you're looking at a distance?
Yeah, we have one room, we call that for the staff, teaching staff. In there we have also mannequin, that's we do in there, and we teach them in there using online and using the what you call it, the videos, and then we teach them, just make demonstration in front of them, how to make assessment, and then what the result and what the interpretation for that.
Okay, the next question is anyone can answer. The question is why COVID is predominant in males? Do hormone testosterone have a role of virus infection?
I can. Yes.
You want to answer that, Farzana?
Yeah.
Okay, please.
There is no role of testosterone in virus infection. The infection is in male because of the male are going outside frequently, and they have to work, and they have to mix with another people, and most of the female are remain in house and at housewife, and they are frequently hand their wash during doing their household work, and the male and hasn't got the chance of doing that. I think that's the reason, but and I'm sure that there is no testosterone role in virus infection.
Okay, thank you. In relation to that, maybe Dr. Vineet can answer this one. Because earlier you mentioned, Vineet, you mentioned that children, which I also mentioned, that children are less affected than the adults. The question raised by one of the participants.
Yes. Hello.
Compared to the adults, Vineet.
Yeah.
I think you mentioned that in your lecture.
Yeah, the thing is that we do a lot of vaccinations on kids. It could be for chickenpox or BCG, polio, everything. So, am I audible? Hello, am I audible?
Yeah, can you speak? I think.
Yeah. Am I audible? Yeah, right now.
Yes, doctor. Yeah, we can hear you.
So that's what they are going through a lot of vaccination procedures for the. For
I'm having problems.
And another important thing is like we safeguard
you
our
mentioned
children.
Vaccination.
Yeah, we safeguard our children so much. We don't let them outside. We keep them. Once we knew about this, We don't allow them to, we safeguard them so much. So we don't allow them to go outside for a play or something. We don't allow for any other interactions with anybody. So that could also be one of the reasons. So we are overprotective of our children. Maybe
I think basically what Farzana said, I think vaccination is actually a generalized vaccination, but I think the answer to this children being affected less initially is because of the fact that what Farzana mentioned is that the males are going out to work and they're getting affected more. So children and women are getting less in the households. And that's the reason. But lately they are noticing that actually children are actually equally, if not about the same level as adults. And that's because some of the positive cases of adults coming back home getting affected the children. So children are now, they were initially thought they were immune because of some reason, but actually now they are more or less getting the same infection as the others, children in many countries. Okay, that answers that. I'll go to the next one. Nutrition we have answered. How many strains of COVID-19 are there? As more persons become asymptomatic, can the intelligent virus start mutating? How many strains are there? Anybody knows?
I think it's already mutated, I think. So
yeah, actually
there's a 32 something. Something like that.
More than 80, more than 80.
Yeah, Farzana?
More than 80.
More than 80, yeah. So the virus is mutating actually, you're saying that. And coronavirus is a group of viruses and there are many viruses in that group. So the current virus which was found actually is already different groups. So there are different viruses. In fact, the one in China is different from the one in Europe, and the one in Europe is slightly different from one in some of the Asian region. So it is already mutating, and we don't know which actually virus is affecting each country. And so that I think answers that question. How can a vaccine, next question. How can a vaccine found for a single niche would fight against mutating COVID virus among the diversified global population? I think that's a difficult one. Yes, because the virus is mutating, a single vaccine may not be able to give a solution to that. And you may have to have a polyvalent vaccine or whatever. So we are not sure on that one. Any other questions? From Belur Shiva Prasad. This is maybe Vineet or one of you. Does not the COVID-19 spread curve shape depends on population density of population and the willingness of person to get tested?
Yeah, definitely it depends upon the population density and the amount of testing you do. So that is when you get the confirmed number of cases. So it definitely depends upon the testing, the amount of testing it's done.
Yeah, no, the issue is, I think he's raising it because if you, I think Vineet, you are the one who showed the graph of the other one. If you do more tests, which I think we have not discussed, because one of the questions earlier was, which I answered actually, is that in African countries, the number of cases are low. If you remember my chart, very low. The issue is, if we test, talking about a curve, Dr. Vineet,
yes.
If the number of tests are low, we are actually keeping the graph low.
Pretty much flattened, yes.
Yeah, flattened. But it may not be showing the actual situation because if we increase the number of tests.
Oh, so that's why now we have adapted to this random testing.
Cases.
Yeah, that's why now it's been adopted as a random testing where you do in specific communities or specific areas or specific persons. So it is for health personnel, it's for police personnel. So you do a random testing on a community, then that's when you get a clear picture of how much the virus has infiltrated. So that is when you get a proper curve.
Yeah.
So that would be
because I think the number of tests is very important. Two things. One is the number of tests, very important. And number two, the sensitivity and specificity of the test.
Test, yeah.
The test kit. And now America is actually having 1.5 million cases. And they have done 14 million tests, if I'm right. Yes. Compared to many other countries which are doing, the number of tests is very low. And because the number of tests is low, the number of cases are low. And so we may not be getting the actual situation, in the country concerned. And we'll never get the number of cases because 80% of the cases may be mild anyway. So they might just have a mild case and finish it off. You understand? So that may be the situation.
And this depends upon the testing kits also. So when you have a lot of testing kits that is coming into, so you're liable to do more tests.
Yeah, I think India had some problem in the testing kit. I think you have now making your own testing kit, because the sensitivity of the test kit is important, because if you have a sensitivity of 80%, you are likely to get 80% positive as opposed to 90%. Anyway, that's another matter. Maybe the last two questions. What do the countries whose COVID-19 cases curve has flattened have in common in terms of their strategies for their infection control? What can we learn from them? I'm not sure what it means. That means if those countries which are able to flatten the curve, what can we learn from them?
I think Taiwan.
Yeah.
I think I have mentioned in my presentation, there are two strategies mainly adapted from the countries: mitigation and suppression. Those countries who have adapted the suppression, which is the lockdown from the beginning, now they have the ability to control the epidemic well compared to the other countries.
Yeah. I hope that answers the question. Okay, the next one. What will be the impact of COVID-19, the economy and the education? Economy and education. Impact of COVID-19 to the economy and education. I think somebody covered economy. Was it Chandana? Sorry. You covered the economy, I think.
Yes. Now, for example, economy. Now, there are countries which have their economic activities within the country and sometimes outside the country as well. For example, most of the rich countries, their money is generated not only within the country, but they have businesses outside the country as well. So the smaller countries or the not such higher rich countries, in their economies, the most of the money is generated within the country. So those economies will be more affected. And we have to consider that. And on the other hand, there are some countries which were able to get out of the COVID threat sooner, and some countries are taking more time to getting out of the COVID threat. So the countries which have recovered early can have a kickstart and have some economic forward more than the others. So that is on the economic side. I think Professor has touched upon the education, and I think education also have to find new dimensions as well.
Okay, thanks, Chandana. I think the last question, I will answer this last question. Anyone can answer. How do the speakers can explain the relationship between herd immunity and Charles Darwin theory of natural selection, especially in developing countries? Anybody want to answer that?
I think,
How will immunity?
okay, I think it's danger if we took the herd immunity, because we will let people going outside. We let people going outside and get infection without any cure, and then we are hoping they have built their self immunity. This is very dangerous for developing country, especially with the high number of people like Indonesia, India, and China. It's very, very dangerous. And one more thing, I just want to give information. They said there is small number of children who infected to the COVID, but the survey there in Indonesian Pediatrician Association, they have a high number of children has infected with COVID. But the symptom is very, very less symptom, just only coughing and then fever a little bit and then diarrhea. So less symptom, but high number that now in Indonesia, children has infected with the COVID. So then let people go outside to get the herd immunity. It's very, very dangerous because we will lose people just like Indonesia. If we do like that, there's around 12 million people will die, especially in the big city.
Okay.
I don't think so. We can adopt for this one. Thank you.
Yeah. Okay. I think the herd immunity and Charles Darwin theory of natural selection actually is more or less the same, because if you natural selection theory says that actually the stronger one will survive and live and the weaker ones will just die and pass off. So what happens is the people who are immune, the higher chances of survival as opposed to those who are not. So my feeling is more or less the same. I think that will be the last question. I won't want to go into that because I'll just wind up now. We're getting late, maybe. I think this COVID-19 is here to stay. My feeling is going to go on for another couple of years or so. And it's not going to be easy to eradicate. And there probably maybe a second wave, because China has already just in the last week actually having 2 cities, Jilin and one other city, I think cases are coming up again. So it's not going to be cleared very soon. And some other countries, the cases are increasing. So it's related to 2 things I think we discussed. One is the test kit, which the more you test you do, the more cases you get. And tests are not very cheap, they're expensive. So developing countries have a problem of getting the test kit. And then the next thing is the type of test, the sensitivity and specificity of the test. If the test is sensitive, you pick up more number of cases, number 1. Number 2, I think way forward, as we think the healthcare systems are not really, some of these healthcare systems are not able to cope with this new pandemic. And so we have to prepare for that. And so the answer is actually mitigation, as I think Vineet and others have mentioned, that we need to flatten the curve. And flatten the curve mainly because to make sure that the healthcare system is able to handle the ICU cases, which are taken care of. So at the moment, I think the flattening of the curve varies from country to country. All guidelines, there'll be some slight variations in there. But a bigger problem of this COVID-19 is actually I think which some of you have alluded, is the issue of economy. Most economies are having a major problem because we are doing most of the businesses are closed and they're working from home, and it's not the same as before, and people are losing jobs. So the economy is being affected in all the countries, and this is going to, it can only recover after this COVID-19 is actually able to pass, and this may take some time for this economy to improve. The sector which is going to be mainly affected in this thing, in this COVID, is actually the one is the tourist sector, which I think all countries are going to have a major problem in tourism and travel. Airlines are now, as you know, all grounded all over the world. And so we are not traveling, airlines are losing. So shipping, the tourist industry is also losing out. So that's going to be a major recovery from this is going to take a lot of time. And education sector is going to change. My personal feeling is COVID has forced the education sector, which I think Prof. Nurpudji has mentioned, into a lot of online learning and online and what do you call, students will start getting used to this sort of thing in the future, and university will take advantage of this and stabilize this sort of thing, learning, rather than on-site, which things likely to happen. So education sector may be but I think more importantly is the lifestyle. The lifestyle in terms of the individuals. Now we are home and staying at home. Of course, there are pressures in terms of how do we handle nutrition, how do we handle our mental stress, how do we handle our anxiety and all this thing, anxiety to go back to work, anxiety to go back to school. And even you have an outbreak in the school, what do we do next? So there are a lot of questions to be answered, and really not many people have these questions. So I hope that with this, what do you call that, the people in the future will work towards improving this section. Now I'd like to conclude by thanking the panelists. I think you have done a very, very good job in preparation. Dr. Chandana, Dr. Vineet, Dr. Surangi, and Dr. Nurpudji, and Fazana for not only preparing the what do you call your session, your lectures, but also to be able to answer some of the questions, which are tough questions, just offhand. So I'd like to thank the panelists. I also like to thank all the participants from all over the world, and thank you for your questions, and thank you for your comments, which you have been posting on the chat. Some of them good chats, good comments on the speakers and things like that. So with that, I would like to conclude and thank you very much, and good evening and good night, and wish you all the best, and hope that each of your country will be able to handle the COVID-19 in the future. To the panelists, I hope to see you again in the near future, and best of luck and good night.
Good night.